According to the American Diabetes Association, diabetes affects millions of people, including more than 10% of people living here in our state of Michigan. And November is National Diabetes Awareness Month, but with Halloween coming up and already a bunch of candy laying around the house, possibly, we thought it might be a good time to talk to Wendy Stuebs of Bronson. She is a clinical dietitian at Bronson. Wendy, nice to have you with us. Good morning.
Thanks. Good to be here.
I guess we start out with what is it? What is diabetes? And there's a couple types.
So diabetes is a condition where the body has difficulty utilizing carbohydrates for energy. So the body typically turns carbohydrates into glucose, which is kind of like the gas in a car. That's what we use for our energy. And when you have diabetes, you have difficulty utilizing that glucose. There's two different kinds of diabetes. There's type 1 diabetes, where the body doesn't make any insulin, and insulin is the hormone that allows us to utilize glucose for energy. So patients with type 1 diabetes have to take insulin injections daily. And then there's type 2 diabetes, where the body makes insulin, but the body doesn't respond to it the way that it should. It's called insulin resistance. And the majority of people have type 2 diabetes. And then to complicate matters, there's another condition called prediabetes, where the body is starting to get some higher blood sugars, has some insulin resistance, but not yet high enough blood sugars to say that someone has full-blown type 2 diabetes.
And the tough part is if it's not treated properly, it's very serious.
Yes, there are a number of complications that can happen if it's not treated. The high blood sugars can damage blood vessels in the eyes. They can damage nerves, kidneys. Heart disease is actually one of the most common complications of type 2 diabetes.
Sure, the doc pokes my toes with a pin when I go in there to see him.
Yes. So they're doing a sensation test to make sure that you're not losing any feeling in any parts of your foot.
Yep. So far, I've been able to yowl nice and loud, and so I guess everything's good then.
Good. Yes. And preventing those complications is certainly possible and a great goal if somebody has diabetes. It just takes having annual exams with an eye doctor, your regular doctor, to get some testing done, some blood work done, and then just making sure that you're maintaining good blood sugar control and also good blood pressure and cholesterol control as well.
Yeah, and that eye exam's so important because that's a nice way to tell if there's something going on. If they see scarring in the retina, then that's a red flag.
Correct, and it's not something that you feel, so you really do need that visual exam from a dilated eye exam with an eye professional.
Okay, Halloween's coming up, which means candy and sweets all over the place. Any advice for us?
So this is such a difficult time of year if you like candy, that's for sure. So if you're going to have candy in the house for events for the kids or passing it out, one of the best things you can do is to pass out candy that you don't like. So we are all tempted to buy the candy that's our favorite, and that's the one we're going to hand out, but then we're going to munch on it throughout the week. So if you keep something in the house that you're not really tempted by, that's helpful. And then keeping it out of sight, so not keeping a candy dish, out on the end table, that kind of thing, and then making sure that you're not getting overly hungry. So eating regular meals and snacks so that you don't get overly hungry, and then you're tempted to want to grab that candy. And then drinking plenty of water and chewing gum, actually. So you've got something in your mouth, kind of keeping those chompers busy can sometimes help as well.
My wife has a bag of candy kind of hidden away. It's not hidden all that well because I know where it is. I wonder if she could put a taser in there.
Some negative feedback there, right?
Right.
So you can enjoy in moderation your favorite candy. So if you want to have one or two pieces and savor that and enjoy that, that's great. I think stopping and actually paying attention to what it tastes like and enjoying it as opposed to kind of mindlessly grabbing it and eating it, which is what a lot of us are tempted to do, especially when we're in a hurry or we're stressed.
That's the key. I know Bronson has a lot of programs and classes. Tell us about a little bit of it.
So Bronson offers diabetes education classes both in Kalamazoo and also at Battle Creek Hospital. And so if you're a newly diagnosed a person with diabetes, or even if you've had diabetes for a while and you just need a refresher, you are typically eligible under most insurances for some coverage for diabetes education. So your doctor would just need to write a referral for you to come back for some education. We also have diabetes and endocrine specialists in Kalamazoo, and we have one provider that is out in Battle Creek as well. So if you have diabetes and need a doctor that specializes in diabetes or a provider that specializes in diabetes, we have that as well.
Excellent, and we can find out about them at bronsonhealth.com.
Correct.
Is there a direct number for the Bronson Diabetes Center?
Yes, 269-341-8585.
341-8585. Good.
Correct.
Got that. Well, Wendy Stuebs, clinical dietitian at Bronson, thanks so much for joining us today.
Thank you. It's good to be here.